Welcome back into Talking Fitchburg. Joining me today from Dane County Emergency Management, we have Eric Anderson. Eric, welcome to Talking Fitchburg. How are you doing today?
I'm doing fantastic, Jeremy. Thanks for having me.
Thank you for being on. Today, we're going to talk about an awesome app that has been out now for a while. It's called Pulse Point. And if you haven't heard about it, we're going to explore all the great things that are important about it and how you can get involved in using it. So first and foremost, Eric, Dane County Emergency Management, what do you guys deal with overall? And I know you're on the EMS side of things too. So, it's a loaded question, but what services do you guys provide to Dane County?
Yeah, absolutely. So the overarching role of Dane County Emergency Management is to support our local municipalities and our communities to prepare for, respond to, and recover from emergencies, whether it's flooding. Today we'll talk about sudden cardiac arrest, which fits more into the EMS division, but we are a lot of support and coordination and getting people connected with the resources to help be better prepared and recover from emergencies.
Yeah, and you folks do a great job, and maybe I'm more biased to public safety, but you guys are doing a wonderful job. Pulse Point came out now several years ago. What is Pulse Point for people who are not familiar?
Yeah, absolutely. So in 2015, we partnered with the Meritor Foundation to purchase Pulse Point. And Pulse Point is an app that essentially integrates with our 911 system. And Pulse Point will use your location and your cell phone. And depending on the location of a cardiac arrest, it has the potential to alert you that CPR is needed in that area. So for example, if I was in a public setting, if I was in a local park and somebody experienced a cardiac arrest, 911 would be able to alert me as somebody who's CPR trained and has the activations alerted to go and respond and provide care to that patient before EMS or law enforcement get there.
And why is it so important to have this tool at our fingertips when we're talking about that sudden cardiac arrest?
Yeah, absolutely. So time is everything, and this is a situation. I think a good phrase is we are each other's best chance when it comes to sudden cardiac arrest, because even in the best scenarios, EMS might be 5 to 6 minutes away, and that's in a really good scenario. So the more time that we can spend providing quality CPR to that patient if they have experienced a cardiac arrest is going to give them a better chance to respond to the treatments that the ambulance and the fire department are going to provide.
How about success stories? So has it worked? We've had this for a while now. What are some of the success stories that you've heard from this Pulse Point app?
Yeah, absolutely. So I think probably the most publicly recognized, there was a student at Madison College that experienced a sudden cardiac arrest. And you talk about, it's a tragic situation, but the best case scenario, if you collapse in a room full of paramedics and paramedic instructors, and the staff throughout the school were notified via the Pulse Point app, and they were able to go and render aid while the paramedics were coming. And that patient ended up having a great outcome. And we're hopeful that she'll be a speaker at our upcoming survivor celebration.
That's awesome. And yeah, it is so important. Timing is everything with these situations, no matter what it is. Overall, for people who are interested in Pulse Point and downloading the app, how can they where can they find it, and what would be some of the things you'd point out for usage?
Yeah, definitely. So anywhere that you get apps. So if you're on an iPhone, you could get it wherever you download anything else. When you look for Pulse Point, you want to look for one of two things. It's a red icon for what we call Pulse Point Respond, which is the app that will alert you to CPR. It's a little red block with a pin and then an EKG line through it. And then the other one that I would suggest that people get is called Pulse Point AED, which is the exact same logo. It's just in yellow. It's a free app. You can download it. When you're setting that app up, just make sure that a couple of things happen. Make sure that when you get into the app, you are subscribed to the CPR alerts, if you're trained and you're comfortable doing so. And make sure that in your phone, you're allowing the app to track your location, because it won't work unless that phone knows where you are in proximity to it.
As far as looking down the road and other ideas for Pulse Point, is there any other tools that can be added to Pulse Point, or anything that we've learned from using this that you guys have made adjustments to it? Without knowing too much more in depth, I have Pulse Point, but what other features could you guys expand on in the future? Or are we kind of, this is working and we're going to keep up with it?
It is working, but we always have room to expand. So two of the areas that we're really digging into, the first one is that Pulse Point AED. So we do have a registry of registered AEDs in our area, and we now have that connected to our 911 center. So our 911 call takers are fabulous at providing chest compression diagnostics, helping people through that if they're not trained or they're not initially comfortable, to try and get chest compressions going as quickly as possible. And now we have that AED registry connected so that if you're within a certain distance of an AED, they can tell you. They no longer have to ask if one's available. They can say, hey, you have this defibrillator, send somebody to go get it if you can. So that's one area of expansion. The other area is a program called Verified Responder. And this is something that the Madison Fire Department did implement a few years ago. And we know that 3/4 of cardiac arrests happen within a person's home. And that's something that right now in Pulse Point to the general public, we're not alerting them to. And that's admittedly a gap. If we have 3/4 of people having this event at their home, we need to get people to their home as quickly as possible. So the Verified Responder program proved promising, and that's something that we're pursuing for the rest of the county. Again, right now, that's the City of Madison Fire Department. But the idea is that if you are affiliated with an EMS agency and we have the background check and we verify that you are an EMS or a fire department professional in our area, then you would be given the updated permissions to be able to respond into people's homes. So that's not something that we're expanding to the general public. I won't say that will never happen, never say never, but right now we're just trying to get people connected with defibrillators as quickly as possible and trying to get to the alerts in the patient's homes as much as we can.
Yeah, and you really think of the history of all of this. I mean, the basic of just trying to get people to do CPR classes, and now we have this at our fingertips, is just amazing. And this might be a great chance to remind folks, Eric, why is it so important to take those CPR classes, no matter who you are?
Yeah, absolutely. I think the first and foremost reason is you never know whether or not it's a training you hope you never have to need, but if you do need it, it's something that you want to be comfortable with and you want to be able to spring into action. I think it's a training that to the general public up until recently, it was maybe a little cost prohibitive or just difficult to find a class, but something that we're trying to push out now is a process called hands-only CPR, so that, John Q. Public doesn't have to go to a formal course and take a test and all that kind of stuff to feel like they have the tools needed to help somebody in cardiac arrest. And there are a lot of videos, and again, the 911 call center will help refresh your memory if you're CPR trained, but you're just in an incredibly stressful moment that maybe you haven't experienced before. They'll help you coach through that. But that's something that any hands on the chest and getting as best of chest compressions as we can is going to give that patient the best chance.
Absolutely, Eric. This has been great information. Appreciate your time. Any other comments on Pulse Point or Dane County EMS or emergency management?
I just want to thank all the EMS, fire department, law enforcement professionals who do what they do. I want to thank anybody who does take the initiative to download the Pulse Point app. And if you do have the opportunity to use the app, or if you're alerted, please fill out the survey afterwards. That helps us a great deal in getting better care to people when they need it.
Well, great work, Eric. Thank you so much for your time. You're a friend of the show now forever, so hopefully we can have you back on down the road. And tell Carrie Meyer hi for me. As I said before, she's even a former EMS partner there, so she's great. But you guys are doing some great stuff there, and we appreciate your time.
Absolutely appreciate it. Thanks, Jeremy.
You bet. Pulse Point app. Check out the Dane County website under emergency management. You can download or just search that app store and find Pulse Point today and the AED version as well. We'll take a quick break. More to come. You're watching Talking Fitchburg.